This is Gabe Gutierrez. From Los Angeles to Chicago to Dallas, the COVID testing lines this week have been growing.
I mean, we were seeing about maybe 150, 200 people a day. Now we're seeing upwards and topping and over 500 right now.
114 Americans are testing positive every minute. In New York City, a pre-Thanksgiving rush gave way to a steady stream today.
I think it's important to get tested, even if you aren't showing symptoms.
Still, the country's largest nursing union says a survey of 15,000 nurses shows 2/3 have never been tested. This despite major sports leagues conducting thousands of COVID tests a week for their athletes.
It is absolutely outrageous that national sports stars are getting routinely tested when nurses aren't. Nurses are your line of defense. They're your only line of defense.
At Texas A&M University, researchers are working on a COVID-19 breathalyzer. In less than a minute, results could potentially be sent to someone's smartphone, though it still would require emergency use authorization from the FDA. 9 months into the pandemic, some states are still reporting a testing backlog as labs are overwhelmed. In North Dakota, results are taking 5 to 7 days.
It makes it very difficult because people are wondering if they should stay at home or if they are okay to go to work.
But is getting tested even enough? A question being asked by families across the country as the holiday season is just beginning.
Testing should be reserved for what you want to test for. If you are sick, if you're worried that you could expose others, but it only gives you that snapshot in that one moment in time. So unfortunately, a negative test does not give you the all clear.
And Gabe joins us now from New York, where the governor says he's considering a winter plan that will likely include more testing in schools.
Yeah, Lester, it's not exactly clear how that will work at this point. The mayor here faced backlash for closing schools, but the governor now says increased testing inside classrooms will be crucial to reopening them this winter. Lester?
All right, Gabe, thanks very much. Dr. John Torres joins us now to clear up some misconceptions about testing, especially in light of all the travel and family gatherings. Dr. John, how much should people be relying on these tests?
Lester, we all need to realize that these tests are essentially just that. They're a snapshot in time. So if you're negative today, that doesn't mean you won't be positive tomorrow. For example, you could be exposed today, test negative in 5 days. Then on day 8, you hang out with friends and family thinking you're fine, only to develop symptoms and test positive on day 10. So you expose all those others without knowing you're contagious. And that's why it's important to realize that testing is just one of the steps, along with quarantining, avoiding crowds, wearing a mask, and social distancing that can help make sure you don't have the virus or spread it to others.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.